Welcome everyone. Thank you so much for joining us today. My name's Bree. I'm the Health Promotion Coordinator for Arthritis Queensland. And before we start, I'd just like to mention that this presentation contains general information and advice. The content is not a substitute for the individual advice of your doctor or health professional. So always have a chat to your doctor or healthcare team to obtain individual medical or treatment advice. And in the spirit of reconciliation, Arthritis Queensland and New South Wales acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Okay, so today's webinar is all about the cognitive behavioural therapy and arthritis, and I'm really excited to introduce our special guest speaker joining us today. So Dr. Jane Wheatley is a clinical and health psychologist currently working as a part of a multidisciplinary team in the areas of chronic pain and long COVID for St. Vincent's Hospital, Sydney. Dr. Wheatley has been involved as a clinician in individual and group treatment in chronic pain, as well as program development in the area of chronic pain and illness education and skills training for the past 15 plus years. Dr. Wheatley has recently been involved in applying her experience and knowledge in developing the St. Vincent's Long COVID Assessment, COVID Clinic Assessment and treatment resources in relation to group and individual psychological interventions. Jane has a strong interest in the translation of research into clinical practice. Her doctoral research examined health behaviour change, and she recently was involved in research exploring the efficacy of telehealth support for people engaging with online pain management programs. So now I'll pass it over to you, Jane.
Thank you very much. I think I need to get a shorter bio. Thank you everyone for coming today. It's really exciting to have the opportunity to talk about cognitive behavioural therapy and how it can help people managing with arthritis. I also would like to pay my respects to the traditional owners of the land on which we meet today. I'm on Gadigal land, so I'd like to pay my respects to the Gadigal people of the Eora Nation and pay my respects to elders past, present and emerging. And to those on the lands on which each of you are, I'd also like to acknowledge those as well. So you might have seen this particular image before, you may not have, but it looks at all of the costs of, arthritis, the fact that people aren't able to work, the fact that there are so many people managing with arthritis, the fact that it causes people to have to retire early. It's the second most common cause of early retirement. The fact that it's, quite expensive for the healthcare system. And that's, something that I guess governments collect a lot of, information on, and they find it really important because, of course, they're looking at the economy, they're looking at costs of things. But it doesn't really get down to just how much it's impacting on people as individuals and your own lives. So I think that's actually really important. And thankfully, a lot of, the healthcare system is now starting to understand that and starting to look at some of those areas. So, of course, there are, the biological factors, those things that are going on for people. So what's going on in your body? Do you have, inflammation going on at the time? Do you have other illnesses as well as arthritis? Is it affecting other things like your brain function? Is it affecting things like your activity? And then that also affects things like your mood, how much stress you're experiencing, what you then do and how you're coping with all of that. And then that has further effects on, who you're interacting with, whether you want to go out and socialize, whether you're able to do the things that you enjoy with family and friends. It might also then affect things like your income and the type of supports that you have. So it's really important that we look at all of this, because it's not just, well, if we get rid of this bit, everything's going to be fine. It's impacted on so many areas of our life that actually we need to make some changes in a few different areas. So I'm a psychologist, of course. So one of the things that we look at is, what sort of effect does, illness have then on people's mood? And we know that with arthritis, it's really quite common that people go on to have diagnoses of things like depression. So, it's about well, it's just under 20% of people with arthritis also have symptoms of depression. Now, that might be that they've had depression in the past and, you know, it's then brought those symptoms back, or it might be that it's brand new, that they haven't had symptoms of depression before, but since their diagnosis, they've actually started to have symptoms associated with depression. So, you know, for example, people with rheumatoid arthritis, they've done lots of studies where they've found that actually those people are at a much higher risk of getting a diagnosis of clinical depression than those that don't. So it's really, really common. And as you can see, it then starts to affect a lot of other areas. It actually starts to affect you physically with some of those symptoms of feeling more tired, feeling more run down, which you may actually already be getting as a result of, you know, your arthritis or autoimmune conditions. And so it can actually then exacerbate all of that and make it worse. It can then make you not want to go out, not want to do things, not want to be around others. So it's really important that we actually look at some of these areas. The other big one is anxiety. So, and this is just over 1 in 5 people. So 21% of people are also dealing with anxiety symptoms. And so, you know, what we've found is that then, you know, the people that are having sort of more anxiety with their arthritis, they might also then have more problems with, say, you know, going out and doing things. They might avoid more situations that make them feel anxious, and that really affects your quality of life as well. So, of course, I work in pain management predominantly. And so one of the things I look at is, you know, how then pain, you know, can be a consequence of having, you know, various types of arthritis, how that then affects what we do, how we function, how we cope. So what can happen here is that, you know, we can have changes, you know, to our system where we're getting more stiffness, more fatigue, more physical limitations. And so we might also find then that because we can't do as much, we might start doing less. So we start to avoid activities because they make us feel sore, they make us feel really tired. We then find that we become deconditioned, so our body's, you know, not as strong as it was. It's not, you know, the muscles aren't as strong. It's not able to do as much. It's starting to get a bit sore. It's starting to get a bit more stiff. And so it actually then takes less activity for our pain to then be triggered off. This can then also cause problems in terms of our sleep. So we then might not sleep as well because we've got more pain. And also when we're not doing activity, that actually makes it harder to sleep as well. So that also then changes our system where it's actually going, oh, there's lots of things that aren't going too well. That seems rather dangerous for our body. So therefore it lowers the threshold on when it then will trigger off pain. So then we start in this little cycle where actually things can just start to get worse and worse. On the other side of things, when we do start to have those increased difficulties with more pain or pain triggering off more easily, we also start to have more changes to our mood. And those changes mean that we then start to do things differently. So we might not go out with friends as much because it's, you know, it's too tiring, it's too painful, I'm not going to have a good time, all of that sort of thing. Then that leads us to become pretty isolated. So it then starts to affect our mood. So we might then feel more depressed, more sad, more angry, more anxious. And that also then magnifies our system's way of talking about pain. So it actually makes the pain feel even worse, which then, of course, makes us feel even more angry or more sad or more anxious or more fearful that actually we might do damage if we move and use our body. So it really does start to then impact on our psychological well-being, our social well-being, and also our physical well-being. So this is where CBT comes into play, so Cognitive Behavioural Therapy. So we're basically trying to look at all of those things, all those areas that have been impacted, all of those changes that have happened. And it's looking at the relationship between all of those things. So how do they interact with one another? You know, how do situations in our day, our week, our life affect how we think about things, then how we feel about them, then what happens in our body, and also what we then do. So CBT was originally developed to help people with depression, but since then it's been used in lots of different areas to help with things like anxiety, with eating disorders, with sleeping problems like insomnia, and with chronic pain. So in relation to arthritis specifically, there's lots of new research now that's actually looking at which components of CBT are the most important for people who are managing arthritis, which ways of doing it work best. So it might be individual, or it could be group, or it could be online, as well as what other areas of wellbeing might also be able to be addressed for people with arthritis. So, well, what is CBT? So what to expect, I guess. CBT is typically conducted through a structured and collaborative approach. So that's where, the therapist and the individual experiencing, pain or managing arthritis will work together to come up with a plan of how they're going to best, move forward. So you'd need to be assessed. So there'd be an initial assessment with lots of questions about lots of different areas of your life to look at all of the things that might be having an impact on your mood, on your ability to cope with, illness and with pain, things that you're doing that might be really helpful as well, so that we can, do more of those, not less. And so all those social factors as well that might be having an impact too. So we look at all of that, and then we help you to come up with a plan as to, well, look, what's important to you? Because what's important to me might not be completely different to what's important to you. And if you're the person who's actually dealing with the illness or dealing with pain, it's far more important that we look at, okay, what are the big changes that have happened for you where you'd like to actually get some improvement happening, and where can we start? So that's working together on that. We'd also look at things like, how your thoughts and beliefs impact on your pain, on your function, on your management, and also look at then what we can do in terms of, how can we actually change our behaviour, do some things differently that we might really, like, that we can actually set some goals, achieve some things to move towards the things that are important to us. It also involves some pain coping skills, so some skills training, which involves things like relaxation, maybe some mindfulness meditation, some breathing exercises, and also, some other things like even guided imagery and that sort of thing. There's also things like problem-solving skills, because of course, when we have pain or a medical condition that's with us for some time, it actually starts to cause us so many more problems that we actually then need to figure out where we start and how we solve some of those problems and move through them. And then finally, we also look at, okay, we've actually started to make some improvements, things are going really well, how do we keep that going, and how do we manage any little setbacks that might happen? Now, typically, CBT would be done over several sessions, so it would be between 8 and 12 weeks usually. And it would depend on what the individual needed, what the treatment goals were, and the way it was being delivered. So like I said, an assessment is done, and I apologise, my slide's looking a little odd there, where we look at all of those things. We ask about all of those things because they're all really important in terms of how you're functioning. So when we're actually starting to do treatment, one of the really important things in both chronic pain, and actually a lot of the research is also saying in regards to arthritis specifically, is actually getting a really good basis of understanding and education around our conditions. So in regards to pain, it would be understanding what pain means, knowing that, pain doesn't necessarily mean that we've injured ourselves. It also doesn't necessarily mean that we've got active inflammation going at the time. Things like looking at the importance of not stopping all activities, knowing that movement can actually be helpful, but how to actually go about that. Understanding scans is actually really important as well. We hear a lot of terms on scans, if we read the reports, things like the word degeneration, which I think is the worst word they've ever decided to put on scans, because people think the word degeneration means that they're kind of crumbling and falling apart. Degeneration basically in medical terms when we're looking at scans means age-related changes. So, and it's not a straight line. So it's one of those areas where when people don't understand, it can actually make them quite worried about what's going on in their body and quite concerned that there are some really dangerous things happening. And all of that actually drives our system to make it wind up and experience things like more pain. It's also really important in terms of education to start looking at what the person already knows, because you might have already learnt quite a bit, and it's making sure that we're actually you know, not giving you information you don't need, but also helping you fill out bits of information that you might not have yet. In terms of, let's say you've been diagnosed with rheumatoid arthritis, one of the important things is actually to understand what the illness is, what the symptoms are, and what you might be expected to experience as a result of this. Also, what treatments are available and what the course of the illness is, so that you know what to expect in the future. When they've sort of done some surveys and research into what people were most concerned about in regards to, you know, having been diagnosed with arthritis, was actually what's going to happen down the track. And that's really understandable that people would want to know, you know, how are things going to change in the future? Is it going to be that things just get worse and worse and worse? Or is it going to be that this is as bad as it gets? Or is it going to be that things can actually improve? The other thing to really be aware of is also what support's available, because it can feel really isolating when you think you're the only one dealing with these issues and illnesses. And it can also be really difficult when you don't know what sort of things that you're able to access to help you out. Now, one of the things that we find really important just in relation to pain itself is understanding how that affects our health in relation to stress. So when we're talking about stress, what we're talking about is stress on the actual system. So stress can be really helpful in the short term for our system. It might motivate us to overcome a challenge or learn to do something new. But high or repeated stress can result in some unhelpful changes to our brain and body, which can actually then affect the quality of our life. So what we're talking about when we're talking about stress, we're talking about things that are stressors on the system. And lots of things can be stressors. You know, an argument with a parent or a loved one can be a stressor. Illnesses, you know, that cause changes in our body can also be stressors on the system. Pain itself is a stressor. You know, it's talking about, you know, oh, I'm worried that there's something wrong here. And so that then winds up our stress response system going, well, I better prepare for danger. And that's fine in short bursts, but it's not great when it's active, you know, for a long period of time, because as you can see on this slide, it causes a lot of different changes to the system. One in particular that can be really important to notice when you've got ongoing pain is that stress response actually causes increased muscle tension, which in itself will cause you more pain. So, you know, because your system thinks that you're in danger, it tightens everything up to try and protect you, but actually muscles being on for really long periods of time just ramps up your pain, because muscles don't really like to be switched on. So that can actually then make things worse. The reason why that can be really helpful to know that is because then that means that you can actually influence the system and help it to learn to decrease some of that tension. So the same thing with some of those other effects of stress is we can actually start to manage those and do something a little bit differently. And it's also really helpful, I think, to know that, you know, if I've got, you know, this prolonged stress, it can affect things like, you know, my memory. I can, you know, be constantly putting my keys down and forgetting where I put them and thinking, oh my goodness, this must mean something really serious, when actually it just means that my system is overstressed and it's not managing everything at once. So it's sort of going, not as important to remember where the keys are because there's a lot of danger about. One of the other areas that, you know, when you're doing CBT with a clinician, one of the other areas that it's really important to get some more understanding in is around the medications. So this particular image here is basically about opioids, because of course in chronic pain we know that at this point long-term use of opioids tends to have more negative effects than helpful ones. So it's not There are some cases where actually it's useful to be on a small regular amount, but by and large, for a lot of conditions now, they're finding that it actually makes people more pain sensitive and actually stops being particularly helpful. And there are other options that are far more helpful. But in terms of other medications, it's important just to know that sometimes there can be side effects with these medications, and sometimes we can mistake the side effects for actually, illness or being unwell when it's actually a medication side effect. So it's important to understand what's going on for you with your medications, because you might not realize that, oh, I'm feeling so fatigued, but it's because of a medication I'm taking. You might just think, oh, I'm feeling fatigued because I'm not sleeping well and I've got a lot of pain. In terms of arthritis in particular, it's also really important, especially when people have first been diagnosed, that they really understand about their medications and how they work, so that that in taking those medications, you might actually be doing things like suppressing your immune system, so that the arthritis, your body isn't attacking itself, and it can slow the progression of the illness. So that can be really helpful just in terms of relieving symptoms at the time, but also reducing the risk of long-term damage. And sometimes when people don't know a lot about how the medications work or why they're supposed to be taking them in a certain way, they get worried about taking them and go, oh, well, I just take it sometimes, or I decided not to take that medication. And actually they're basically putting themselves at risk of some longer-term outcomes of worsening illness, rather than actually it being fairly benign and being manageable. I work quite closely with a physiotherapist because, it'd be lovely to think that, the brain and the mind sit over here separately and that the body can do its own thing, but they're interlinked, they work together. And we know that as part of treatment for lots of conditions, including just general health, but particularly with pain and things like arthritis, we know that movement is actually really important. We also know it's really quite difficult to start, because a lot of times when people have tried to start with movement, they've done too much, or the physiotherapist that they've been to didn't really understand the type of pain or difficulties they were having, and actually pushed them to do things that weren't quite right. And as a result, they had big flare-ups in symptoms and went, okay, exercise is not for me. And it's not that exercise is not good, it's got to be the right type in the right amount. It's really good for things like fatigue. It's good for our overall health. In terms of fatigue, exercise is actually a form of physical stress, but it's actually it's a really good stress in the right amounts, because it helps to burn off some of those stress chemicals. It can actually also help your metabolism, which then reduces those feelings of low energy and fatigue. But you've got to know where to start. And that's where, doing CBT with a clinician who's got experience can be really useful, so that they can help you find the right place to start. In terms of what else physical activity can do, it's also really useful to help increase our cardiorespiratory fitness. So you get less shortness of breath over time when you're moving, helps to improve your range of motion, so it's easier to move. Like I said before, it nourishes your joints, strengthens soft tissues, improves balance. And that actually results then in you being able to do your daily activities more easily. It helps to decrease some of that stiffness that you might get. And it's got basically positive effects on lots of systems in our body. Helps lower the risk of other illnesses. For example, cardiovascular disease, including stroke. It helps to lower blood pressure, and helps with things like diabetes management. So it's actually really, really good for us. I know I've got 2 slides on movement, but that's because movement is actually so important. And it's so important also in terms of my area, which is the brain area, in that it actually helps to release a lot of our brain's natural chemicals that can do things like decrease pain, can help us to feel good, so releasing things like serotonin and dopamine as well. And so, those positive moods then actually help to manage some of those difficulties that we can have with low mood or with anxiety. It also, one of the really amazing things about exercise is it helps our brain to release something called, down the bottom there you can see something that says BDNF. That's called brain-derived neurotrophic factor. Now what that is it's a chemical that actually helps our brain to, so our brains are plastic, they're capable of change and adaptation to things that are going on, but they learn and do it better when this protein is released. So by making some changes in what we're doing in our daily life, plus doing exercise, we're actually making those changes more effective. So our brain learns the changes faster and learns to do things more differently. So I know this is a big slide with a lot on it, but basically on the green side with winds the system down are actually some of the things that might be suggested to you when you're doing a CBT program. So you would be learning things like how to stretch and pace up your activity really gradually so that you're not flaring up your pain, and so you can actually gradually do more and decrease stiffness as well, and hopefully improve mobility and balance. Also doing things like relaxation, meditation and breathing, as well as mindfulness, can really help with both mood and also decreasing that system stress response, which then can also decrease things like muscle tension. And there's things like, of course, taking medication, doing things that help with good mood, working on your sleep, doing things that you enjoy, having good nutrition. They're all really helpful as well. So they're things that are part of a CBT program. Now, I want to show you this little diagram, which is way too complicated because there's a lot happening there. But it's really important just to think about the fact that, like I said, I'm a psychologist, so a lot of the things that I work on, are looking at people's mood and how they might change that, looking at some of the things that they think about and believe about, what they're able to do, about what their pain means and all of that. But the problem is, a lot of people think that, well, if I work on mood or if I, look at my thoughts, that this means that you're saying that my illness is not important or not real, or that my pain is not real. And actually, it's not that. It's just that we are so interconnected, and if we don't work on some of those areas, we're actually not going to be able to make some of the changes within our system. So our system actually responds to those, psychological aspects. So for example, here I've got that, the person has pain and they're quite worried about their pain. So their system and them are interpreting it as something dangerous and really horrible to deal with. So that triggers off a lot of those stress chemicals, might make them feel quite panicked. And then they start to have their system actually trigger off. So our nervous system, our sympathetic nervous system, or our flight-fight response will trigger off, which is part of what encourages that muscle tension. It also starts to change how our system functions in terms of what our gut's doing. So we might start to have some gut problems because everything constricts and starts to change the way that we're digesting food. And it can then lead to things like being even more tired, being more exhausted. So there are lots of areas that we can work on. We can work on the physical things, but if we don't also work on the psychological things, it's not going to improve as easily. So part of what we do in CBT is we actually look at all of those areas and how they might interact. So oftentimes people only see the link between, the first thing of the situations that they might be in this model, so A, the activating event, and the consequences. So it might be that they think there's nothing they can do about it because, when I wake up in the morning, say with a flare up in my pain, I get really upset about it, and then I stay in bed. There's nothing I can do about it, right? But actually, we can't always change our situation, but we can change how we respond to it. And one of the important things is to actually look at how all of that interacts. So I'll give you a quick example with my person waking up with a flare-up in pain. Now, their first thought might be, oh, I can't do anything now, my day's ruined. So then as a result, their emotions might be that they feel really helpless or annoyed or depressed. With that, you know, when you're feeling quite annoyed or depressed and you're in more pain, you might find that you're curling up, you know, you're holding everything tight. You really start to notice more pain as well because everything's feeling really tight and hunched over. As a result, you might decide then to stay in bed all day and watch TV or, you know, sleep. You know, so you might not go out, and that might be what you planned on doing, but you're working up with this flare, you've gone, nothing I can do. Another person might have the same situation where they wake up with a flare-up in pain, but they think to themselves, oh, okay, body's got more pain today, things might get more difficult to get done, and I might need some extra help today, and I might not do quite as much, but I'm still going to get up and go out and try some things. Now, they might still feel quite annoyed because nobody likes pain. So they might be annoyed, but they might actually then feel, you know, happy that they interact with other people during the day. You know, they might get a bit distracted, so it actually might help in terms of, you know, lowering some of their attention on the pain. They might still notice that pain, but they might notice initially when they wake up, oh, I do also have that extra tension building because I've noticed the pain and now everything's starting to tense up. So they might then be able to do something about it in terms of relaxing their body a bit more throughout the day, pacing themselves, and they might end up spending some time with others during the day, still get some activity done and get that sense of achievement at the end of the day. So the situations are the same, but the thing that's different is the way that we're thinking about it. So that's why it's so important. Now, if we're looking at all of those different areas, gosh, where do we even start? Now, often in CBT, we're told to, you know, look at the situation we're in and have a think about what the thoughts are that we're having. Now, I find whenever I do this with people, you know, if I say to them, right, you've woken up in the morning, you've woken up with a flare-up in your pain, what's the first thing you think? They usually don't tell me what they thought because we don't often think about our thoughts. They usually tell me, I felt really annoyed. And we don't actually think I felt really annoyed. They're actually just feeling annoyed. So one of the things, if you want to start to look at how this all, you know, interacts for yourself, is you might start by noticing what your emotion is first, or you might notice what you're doing with your body to begin with. So for example, if I'm not quite sure, like I've just woken up, you know, and I'm not really, I'm just aware that I'm not very happy because I can feel pain. So I might be aware of that, but I'm not really aware of anything else. I might sort of notice, oh, actually, I'm kind of hunched up in a ball. I've got my fists held really tight. Oh God, I'm actually feeling quite angry, you know, and I'm now sort of, you know, the next person that I talk to, I'll probably lash out at them. If I start to notice that and notice what I would normally do, I then have the opportunity to actually decide to do something different with it. So, you know, we can do something different with all of those different areas, which is what we're going to talk about in a second. So the first thing is we might notice our thoughts. Like I said, that can be actually more difficult than you think because we don't often think about what we're thinking. But if we do notice our thoughts, we might sort of, you know, try and see if it's a balanced thought. Is it helpful to us? Is it going to help us do something useful with our day? We also don't want to, I really hate the term positive thinking, because everybody I've ever spoken to that goes, oh, I'm just trying to think positive, they're usually really stressed out and unhappy, but they're trying to do, it's more like wishful thinking where they're just like, oh, I wish I felt happy. So they go, no, I'm just thinking positive. So I actually think it's more important to think about whether the thought is helpful to you. You know, is it actually going to stop you from doing what you want to do completely? Or is it pushing you to actually do way too much where you're actually going, well, I'm just going to ignore that and do things anyway? Or is it that nice balanced space in the middle? So, you know, we can quite often have a lot of ways of thinking that are really unhelpful, but we're not usually very aware of it. So something like this, where you actually go through in a structured way and have a look at, you know, am I thinking all or nothing? You know, I've woken up with more pain, so I can't do anything, rather than I've woken up with a bit of pain, so I'll do a little less. That would sort of be more middle of the road. But is it all or nothing, or is it middle of the road? You know, am I jumping to the worst conclusion? I've got more pain, this is going to be the worst day imaginable. Versus, I've woken up with more pain, that's not great, but I still might be able to make something of the day. So we can actually look at a lot of that. So this is some examples of, you know, some less helpful thoughts and some more helpful ways of thinking about it. And you can actually experiment for yourself and just, you know, go, am I actually thinking something that's going to get me where I want to go and in a way that's going to be manageable? Or am I actually thinking in a way that's going to make me feel worse about things and that's not going to help me? I have actually had people who've you know, been told about, you know, the doctor said, oh, you know, you've got to give up work or you'll be in a wheelchair, you know, and that was their doctor actually panicking and catastrophizing. But when they went and spoke to somebody else, they were like, oh, no, you just need to do things slowly and slowly build up, you know. So it can be quite challenging sometimes when we're getting some unhelpful messages from other people. And it can also be unhelpful when we're getting, say, messages from family just telling us to just get over it or get on with it. So that's also pretty unhelpful too. Now, one of the other things, as I said, we can notice what our emotions are, which sometimes can be more difficult to label than we realize. Because if we're feeling, you know, sad, sometimes we'll label it as, oh, I'm feeling depressed. We're just feeling a bit sad today. So it's you know, kind of important to figure out the difference, because if we're using the really big words for emotions, they're actually, when they're emotionally charged words, they do actually make us feel worse. So am I feeling at the extreme end of things, or am I feeling somewhere in the middle? It can be really important to actually look at that. This example that I've got here on the slide, they actually did a study where what they did was they asked people where they felt temperature change when they were experiencing certain emotions. So the more blue something is, the colder they felt in those areas, and the warmer they felt in particular areas was the, you know, they've got it on the thing as more yellow and red. So it's really interesting that emotions seem to have such a big impact on a lot of areas of our system, including how we're experiencing our own body temperature. And like I said, it can also have an effect on things like muscle tension. You know, our heart might beat faster. We might feel more dizzy when we're feeling certain emotions. And so if we look at what our emotions are and notice them, we then actually have the opportunity to do something different with them, which I'll explain in a minute what we would do with them. So the interesting thing is, you know, emotions have a purpose. And one of the purposes that they have is that they motivate us to do something. So they can also be things like pain magnifiers. So some of the, you know, I hate the word positive and negative when it comes to emotions, because sometimes it feels really good to be sad, and I don't think that's a negative at all. Sometimes it feels good to be angry, but the usually less pleasant emotions to experience, they can often be pain magnifiers as well. They can also be emotions that then make us stop and not do things. So if we're feeling sad, we might want to withdraw from people. We might want to spend time to ourselves, which can be a good thing. But when we're depressed, you know, so if we keep being sad and we stop seeing people altogether, we can then get depressed, which then can actually mean that we want to do things even less with others, which then just becomes a cycle of actually making our mood even worse. So it can be really useful to actually think about, you know, if you're feeling a certain emotion, what's it making me want to do? And is that going to be useful and helpful or not? The other things that we can notice are we using and moving our body differently? So, you know, I mentioned before sort of body posture and position and how that can actually be important and useful. And it's because when we've got an ongoing health condition, especially if it comes with pain, is we can start to change the way that we use our bodies. So in the example there, you know, I also talk about the fact that they can be bracing, guarding, but also breath holding. So we can breath hold, or we can do things like breathe more quickly, higher up in the chest, and that can actually start to trigger some of the other symptoms of panic, or it can start to just, you know, trigger off that stress response more, so that we're actually getting a few more symptoms like, say, increased sweating, or that increased muscle tension, And that can be really worrying for people when they're getting those sorts of symptoms. But if we actually notice that it's happening, like let's say I notice that I'm starting to hold my breath a lot, I can actually start to notice it and then, oh, hang on, if I do something different, and I start to let my muscles relax, that actually feels a little bit better. So we can start to then notice what little things we can change. So these are some of the other things that can happen. And we can also change the way that we move. So, you know, we can start to favour one side. If we've got pain on one side, we can also hold things more rigidly, which actually can then, you know, make things even worse. You know, we're usually doing it because we're trying to not cause ourselves more pain, but actually it can start to make it more painful, or it can make other areas painful because they're being forced to do a lot more because they're compensating for another area. So learning how to move differently with a physiotherapist can then be really helpful in terms of part of your treatment plan. So what can we do differently? So we can do things differently in terms of any of those areas that we talked about earlier. One of the first things, if we're looking at emotions, would be to actually figure out what the emotion is. Like, what am I actually feeling? You know, a lot of times we don't really think about that on a daily basis either. We just sort of, you know, usually get on and go through the day, not really paying attention to our emotions. But sometimes checking in with ourselves and noticing what we're feeling can be really important. One of the things that happens when you label an emotion, you know, if I you know, sort of go through my day and I'm feeling quite agitated, but I haven't actually acknowledged that, I'm more likely to do things, you know, that fit with being really agitated. Like I might, you know, be short with somebody and yell at them, or I might be, you know, more easily frustrated by things during the day. Whereas if I actually go, oh, hang on a sec, I've woken up, I'm feeling a bit more frustrated today. That's interesting. It takes the power out of the emotions, so it's not as strong. Once we label it, it becomes less intense. We can do things like explore, you know, if I'm feeling depressed and let's say I'm holding myself quite down and you know, quite hunched over. What happens if I act the opposite? You know, yeah, I'm still feeling depressed, but what happens if I kind of hold myself, you know, as if I was feeling confident and wanting to go out and do something? Does that change anything, or does it make me feel the same? And it's really interesting, the interactions and what happens when we use our body a bit differently, how our brain comes to the party. So you might not feel ecstatic or, you know, think that things are wonderful, but you might notice that it shifts away from that really, you know, sort of heavy, depressed space or, you know, tight, angry space to actually something that's sitting more in a soft middle space of not being too strong, being a lot less intense. You can also do things like act exactly the opposite. So, okay, I'm feeling really angry. Angry is making me want to be really, you know, tight and squished up. So instead, I'm going to act happy. So how would I hold myself if I was happy? I'd probably be smiling more. I'd probably be open through here. I'd be looking up more. You know, you can explore that even if you feel a bit silly. And it's amazing how it can change things. They sort of say that, you know, I still don't know if this is 100% true, but if you smile, you can't feel fear. You know, but it's interesting to play around with that rather than getting stuck in one emotion. Emotions, by and large, you know, no matter what they are, aren't a problem. It's when we get stuck in them for a period of time and when they stop us from doing things that we actually want to do and that are important to us. So like I said, we can play around with them. You can use different postures, you can use different body positions. And I like the idea of playing with them because being playful, playing is how kids learn. And so if we're a bit playful, you know, it actually makes it more likely that our brain's going to pay a bit of attention and learn something new. The other thing we can do, and, you know, you guys would already know about exercise because, of course, you know, everybody who's got arthritis, I'm sure at some point gets told to exercise. But, you know, you can explore, you know, what sort of movement you might like so that you can find things that help you to slowly increase your confidence. You can find things where, you know, your system actually doesn't mind doing a little bit of it and doesn't immediately trigger a flare-up in your pain. So, for example, you know, people get told to do, say, Tai Chi, for example, which is on my next slide. And some people can't do that standing up, which is fine. You know, that's why chair yoga, chair yoga and chair Tai Chi exists. Because you can actually do things in different ways, but you should do movement and try things that you actually, you know, find enjoyable. That it's not, you know, it's not a chore to have to do it. That it's actually types of movement that you might want to do. That's really important in terms of being something that you're going to do more regularly. Now, Tai Chi is one of the things that we do quite frequently here at our service. And part of that is because there's a lot of evidence that it's actually really good at starting to get you reconnected with your body in a different way. So you can start to notice when things have tightened up, when things are more relaxed. You can start to actually move and use your body differently in more flowing and fluid ways, rather than when we've got stiffness and everything wants to move very rigidly. And there's also lots of ways to modify and adapt it. So it's really helpful there too. Now, depending on the type of pain that you have, you can also experiment with different sensations. So you can actually explore sensations. So because changing sensations generally changes pain, you know, in a positive or a negative direction, if you like. You know, it can change it in lots of different ways, but actually exploring and seeing what your system likes means you can start to try out different things. Let's say you've got, you know, you might have a bit of nerve pain that's causing you some problems in either your hands or your feet, and you find it really difficult to, say, walk on sand at the moment. One of the things that you could try out is trying what different textures and what different temperatures your system likes at the moment. You know, so they can then be things that temporarily you can actually use to help soothe the system. But then you can also start to slowly introduce things that are a bit more challenging for your system, so that it then starts to relearn that these things are actually safe and okay and fine, and it doesn't need to dial up the pain system in response. The other thing that can be really good and that you learn when you're doing CBT is relaxing and breathing. And that's because it helps to wind down the system and it helps to change the pain experience. We definitely don't promise that it's going to get rid of your pain, but it does change the pain. It's also useful in terms of improving your sleep, which can then also improve your mood. So it's something that can be really useful, and there are lots of different ways to do breathing, and some of them help give you a bit more energy, and some of them just help to settle and calm the system. So there are lots of things that you can try. Now, with exercise, I mentioned before, you know, lots of people have been told to exercise. One of the things I'm pretty sure my boss thinks is 90% of what I do is actually helping people to learn how to pace their activities so they're not flaring up their pain. Now, when we've got pain, one of the things that we can do is we can stop doing activity altogether because everything just feels too difficult and we're really worried that we're going to increase our pain. Unfortunately, that means that when we go to do something, it is more difficult and more painful. Or we can do what we call a boom-bust cycle of activity, where we just try and push through and get the things that we need to get done. But as a result, it flares up our pain, and then we have to rest for a really long, you know, period of time, might be a day or more. And then we tend to do the same thing again when we get a good day with our pain. We tend to just go, right, I can get everything done. But then, of course, we can pay for it, as everyone says. The problem with that is over time, our system will tell us about pain earlier and earlier, or enable us to do less before it tells us about pain, because it's saying, I was trying to tell you that I was worried about that amount of activity, but you pushed through and did it anyway. So I've had to tell you about it earlier and earlier, you know, and I'm going to keep doing that until you listen to me. And so when we're trying to pace things, we're trying to find the level that doesn't significantly flare up our pain for a long period of time. You know, it's good to get a couple of measures to find out. Let's say you're trying to improve your walking. You know, you might get a measure on a good day and a measure on a bad day. And then you might go for sort of, you know, a little bit below the middle score. So you might average them out and then drop a little bit off, so that actually you're saying to your system, I'm actually listening to you. You're not ready to do that much. We will get there eventually, but at the moment, you're not ready for that. And then it would be slowly increasing your activity. Now, specific to arthritis, well, not specifically, because there are other conditions that also have this issue, but arthritis, especially rheumatoid arthritis, can also come with the addition of increased fatigue. And for that, we also need to think about not just how we pace exercise, but we also need to think about how we pace our week and what sort of things we choose to do that are important with the amount of energy that we have at the moment. So you might have less energy than you had before. Everyday activities and situations can be really exhausting. And so this is about energy conservation, being mindful of how you use your energy. So if you think about it like money in a bank account, you've only got a certain amount of energy and you need to manage it pretty well. You need to manage your energy by making deposits, which is, resting nice and regularly, trying to improve your sleep, and also withdrawals by using energy based on what you need, what you can afford. So if you end up emptying your bank account by the middle of the day, then you won't have enough for the rest of the day. So there's lots of activities that will sap your energy faster. There's also some activities that will give you more energy. So it's really good to think about what sort of things you're doing over the course of your day and whether or not you're balancing it out nicely between those things that give us energy and those things that take energy from us. So I really quite like this chart that I've got that somebody gave to me in the long COVID world that's got, sort of those increasing intensity of activities. And it's not just physical activities that can drain us, it's also, cognitive or emotional activities that can drain us. I know that, dealing with my mother-in-law sometimes, she's a lovely lady, but sometimes it actually takes a lot of my brain energy because she does like a good natter. And so if I was really stressed or really busy that day, I might say, oh, look, I'll actually call you tomorrow because I might have a bit more energy on that day to actually manage that. So that can be really important as part of your treatment plan. I've already mentioned relaxation and mindfulness. Like I said, they can be really good to help with a lot of different areas, including your mood, including the fact that because it changes your pain and what's happening in your body, it can actually help you to feel like you've got more control over your day-to-day life and also over your pain. And so it can start to then be really quite helpful. And just quickly, this is generally the first breathing technique that I would teach people. So it's abdominal breathing. And so it is just a nice, slow, gentle breath into the stomach. Normal breathing is about 10 breaths a minute. When we overbreathe and definitely having more of the stress response, that's 20 breaths plus per minute. This drops us down to between 5 and 6 breaths a minute and helps to trigger off our system's relaxation response. So it can be really quite good for calming our system, for helping with our pain. And also if we're feeling really tired, it's good for actually helping give us back a little bit of focus and attention and energy if we need it. So I do talk a lot, and I'm very aware that I will run out of time if I'm not careful. So I will quickly go through these, but of course you're going to have the recording for later so you can actually read through the slides. One of the things that is inevitable when you're trying to learn how to manage, pain and illness differently is sometimes you're going to get it wrong. And sometimes also the system is going to flare up and you won't be quite sure why, because it's all of the decisions around when we're going to experience more pain, for example, and when we're not, are all an unconscious process that's going in, in our brain, where it's deciding, is there enough of a threat here to talk about pain? And so we're not always going to get it right, and we're not always going to understand exactly why, but hopefully over time we start to learn more and more of the things that actually increase our pain or the things that actually help to settle our system. So that's where, after we have a flare-up, we can actually look and see, was there anything in the lead up to this that I noticed? Was I not sleeping as well? Was I starting to overdo things? Was I starting to have a lot more of, some unhelpful thoughts because I had to deal with people that I found really difficult, or, there's lots of different reasons. And we can start to notice what those are, which then helps us to get in earlier before we have a flare-up the next time, hopefully. During a flare-up, we can use some helpful thoughts to get us through it. We can do some things a little bit differently. So we want to still sort of keep some of our activity up. You don't want to stop altogether, but we do want to drop it back because we don't want to just keep pushing through. You know, we want to do some good things for our system, but we also know that a little bit of movement and keeping, you know, engaged is actually really good for us overall. So sleep hygiene, I think there might have been a webinar on this previously. That's also part of doing CBT. There are lots of different strategies that you can use, but it's going to be individual, and it's going to be what works for you. The big thing about sleep is not to worry too much about it, you know, if you do wake up, because the more we worry about not sleeping, the harder it is to sleep. Now, I know that there has been some research around whether or not there are any supplements and things like that that can be helpful. There's no magic anything, unfortunately. And it's interesting, some of the research, people go, oh, I'm going to take this supplement because I heard it's really good. A lot of the research has still only been done in, say, you know, let's say mouse populations, which it doesn't always work out to equate to the way it works in humans. But also sometimes it's the amount of the supplement that you would have to take to get benefit is too big, and you know, you actually can't even get that much into your diet. But in terms of pain, one of the things that's been studied pretty extensively is actually in omega-3s. And they've found that omega-3s, that's your fish oils, can actually be really helpful in terms of joint health and in pain. But there are some general rules around diet and nutrition that we have as part of an overall plan when we're doing CBT with people. Finally, if you want to actually make some changes, you've got to figure out what you want to do. So setting goals around the areas that are important to you, making small changes is really important. And it's got to be something that's important to you, or otherwise you're not going to do it. Now, I will say this, I've made it sound like there's a whole bunch of stuff you can do, great, but making changes isn't actually easy. You know, we're asking you to change a behavior that you usually do, which can be really difficult because we're creatures of habit as humans. So making changes takes time for them to become new habits, and they do have to become habits in order for that longer lasting change. So getting support can be helpful, and also, you know, you will from time to time have little setbacks. It's just what happens as humans, we're not perfect. So that's where getting a plan with a psychologist or another therapist can be really quite helpful. Now, just to finish up, how can I actually access CBT if I'm interested? There are lots of ways, there are lots of programs out there. I will just do a quick plug for, well, it's connected to St. Vincent's. It's called the This Way Up service, and they actually have a lot of online courses that you can do, including one that's on pain management. They have ones for depression, generalized anxiety, lots of other areas. They've also got what they've found for people with insomnia particularly, they did some research to find out which program was most helpful. And actually they found the insomnia program was really, really helpful for those people with anxiety, even more so than the anxiety program. So if you are having trouble with sleep, considering how many other areas of your life it starts to impact on, it can be really worth doing something like a CBT insomnia course. And this is the pain program and what it covers. So those are all the areas that we would look at when we're doing a CBT program. And those are some links to not only the This Way Up program, but there's also a Mind Spot pain course. The ACI pain management area has a lot of resources and they're really great videos, things like that. And if you want some just really short information that's easy to take in on pain, the Retrain Pain site is also really good. And they're just some references. Any questions?